Dental implants. Implant surface. The surface may be of importance based on its quantitative or qualitative changes. Quantitative changes may be exemplified by surface topography alterations. Qualitative changes refer to new potentially bioactive surfaces best exemplified by oxidized implants or surfaces doped with potentially active substances. Implant bed. A healthy implant host site is required. Patient characteristics such as age and history of the proposed host sites, such as previous irradiation, will affect the outcome of the implantation procedure. History of smoking may also affect the healing response and osseointegration. Old age does not per se lead to poorer implant results. However, young age is a relative contraindication to the insertion of implants. The general recommendation is to await competition of growth before inserting dental implants in young individuals. Surgical technique. Minimal tissue violence at surgery is essential for proper osseointegration. This objective depends on continuous and careful cooling while surgical drilling is performed at low rotatory rates, with sharp instruments and the use of a graded series of drills. Bone should not be heated beyond 43 degrees Celsius to maintain vitality, and ideally it should not exceed 39 degrees Celsius. Low drilling speeds, i.e., below 2000 revolutions per minute, should be used so as to prevent trauma. The insertion torque should be a moderate level because strong insertion torques may result in stress concentrations around the threads of a screw-type implant with subsequent bone resorption. Loading conditions. The original recommendation to achieve osseointegration is still valid, a two-stage implant insertion. The implant is first inserted in the bone, and then the soft tissues are sutured back so that the implant will be incorporated in the bone under protected conditions. At a second surgical procedure, minimally 3 to 6 months later, the buried implant is exposed and connected to the oral cavity by means of a transepithelial abutment. This procedure guarantees that the implant is well protected during its incorporation in the bone when the osseous interface has not been properly established. Immediate functional loading protocols are also successful, particularly in the mandible between the mental foramina. However, great caution is recommended in the maxilla, particularly if the bone is judged to be of a poor quality. A promising approach for those who prefer a one-stage surgical protocol in combination with direct or rapid loading is to use resonance frequency analysis in an effort to differentiate potentially mobile implants from stable ones.